Hello, everybody, and welcome to the October 17th, 2018 edition of the Ephrom Josine Show. I am your host, Ephrom Josine. Anyway, so the president was asked about climate change on 60 Minutes recently, which I'm surprised is still on the air these days. I mean, that show's been running for a good, 30 years at this point? Oh my god, it's actually been 50 years. As of last month, huh? So consider this our 50-year special for 60 Minutes. Donald Trump not understanding climate change again. Here's what he had to say.
Puerto Rico, Harvey in Texas. Do you still think that climate change is a hoax?
Look, I think something's happening, something's changing, and it'll change back again.
What does that even mean? It will change back again. Like, we know the world is going to get both warmer and cooler because of climate change. Oh my god, Donald Trump just learned about the weather cycle. Oh my, let's clap for him.
I don't think it's a hoax. I think there's probably a difference, but I don't know that it's man-made. I will say this.
We know it's man-made, though. You know, it probably exists, but I don't know if it was created by people. It should also be noted that the 100 companies that are producing 70% of the world's CO2 emissions are very good friends with Donnie and typically have quite a bit of money.
I don't want to give trillions and trillions of dollars
to anything but tax cuts.
I don't want to lose millions and millions of jobs.
To anything but globalization and tax cuts.
I don't want to be put at a disadvantage.
I wish you could go to Greenland, watch these huge chunks of ice just falling into the ocean, raising the sea levels.
And you don't know whether or not that would have happened with or without man. You don't.
Actually, we do, because it didn't happen until just a few centuries ago. Or really until about a century ago, honestly. So we can confirm that if we didn't produce more carbon, more than likely Greenland would not be falling into the ocean and raising sea levels.
Don't know.
Well, you're scientists at
No,
NOAA
we have
and NASA.
scientists that disagree with that.
You know, I was thinking, what if he
Patrick Moore is not a scientist, by the way.
said, no, I've seen the hurricane situations. I've changed my mind. There really is climate change. And I thought, wow, what an impact. What an impact that would make.
I'm not denying climate change,
Yes, you are.
but it could very well go back. You know,
What does that even mean?
we're talking about
Well,
over
that's
millions of
denying it.
years. They say that we had hurricanes that were far worse than what we just had with Michael.
Who says that? They say. I mean, the
People say that in the
Yeah, but what about the
night.
scientists who say
Some people say.
it's worse than ever?
You'd have to show me the scientists because they have a very big political agenda. It's like,
I can't.
As opposed to you, Mr. President, from the Republican Party, who put a climate change denier in head of the EPA and the CEO of ExxonMobil as Secretary of State, and then had him put tariffs on solar panels, and had your party ban solar panels in the state of Florida, and had your best buddy Mitch McConnell take millions from Koch Energy, and had your best buddy Paul Ryan take millions from Koch Energy, and gave Steve Bannon whatever the heck he's on that made him deny climate change. And, okay, it's probably not your fault Sean Hannity exists.
no, scientists also have a political agenda.
So, in conclusion, I have no clue what he even attempted to say there. Anyway, so PragerU released a new video about how bad universal health care would be, and in order to get their proof, their economic genius was a man from the Hoover Institute, which, if you do not know, is literally named after Herbert Hoover. economic genius. But the man they got was a fellow named Lee Hee-che, who, according to this, I'm not making this up, was an advisor to Marco Rubio's presidential campaign and a policy advisor for the Romney-Ryan campaign, including being Governor Romney's chief policy advisor and the senior strategist of a campaign that lost horribly. So, I trust him with politics. I don't know about you. I mean, for God's sake, at least Rove actually had a successful part in politics. As opposed to just sitting there going, listen, I think Romney's gonna win Ohio. But, okay, I'm just going to read this out to you because there's a text version. I prefer doing that than showing the video. It's very easy for a politician to stand up before voters and say healthcare is a right, and then passionately advocate for single payer or free healthcare or Medicare for all, whatever term they might use. Oh my God, they're using terms to define things. I'm already scared. But before we consider the merits of the government managing your health care, and that's what this all boils down to, complete lie, Sanders' bill actually did allow for private sector insurance, maybe we should ask a more basic question. What do we mean by health care? It depends on what your definition of is. Because if you get sick, and here we're talking about major illness, define major illness, sir. Would Alzheimer's count as a major illness? Because that kills you slowly. A fever could kill you. Is that a major illness? If so, I know a lot of people who have had major illnesses. Or maybe he means a pre-existing condition, which could get you denied from health insurance, therefore proving we have the greatest health insurance system. Okay, yeah, they stopped that, I know, but it's just such an easy point. Or you're in serious pain. Well, people are in pain all the time, but okay. You don't just want health care. You want quality health care. Define quality. And where is your best chance of finding that? Well, actually, according to the healthcare satisfaction rate, it's, I believe, Denmark, which has a well over 80% hospital satisfaction rate. And if you mean expectancy of life, which is completely linked to healthcare, give me a second. You would be wanting to live in Japan, which has 83.7 years on average of a life expectancy, and has a single-payer system. Or, to be fair, maybe Japanese just have magic that keeps them from getting sick. I don't know. I doubt that, but I can't be too sure. The answer is right here in America. The statistics say otherwise. For skilled doctors, cutting-edge medical treatment, define cutting-edge. And even then, cutting-edge typically means just new, not necessarily good. There was a point where bloodletting was new, despite the fact it's been proven to do worse than nothing, honestly. Heck, there was a point where it was considered cutting-edge to perform acupuncture, which at best is a placebo and at worst can give you HIV. And care without long delays. Define long. You're using a lot of weasel words here, my dude. Because you're arguing against single payer on PragerU. Okay, this all makes sense now. No other country rivals the United States. Well, I assume if I define your buzzword specifically enough, yeah, not even close. No one from Texas is going to Canada for medical treatment. It's almost always the other way around because they actively can't. It's illegal to get drugs from Canada in the US. Now, mind you, super mega communists, Joseph Stalin, literal Joseph Stalin, Bernie Sanders tried to stop this, which would actually increase free trade and therefore make a more capitalist system. You gonna mention that? But for that matter, yeah, it's actively illegal for someone from the US to go to Canada for their health care. It's also illegal for someone to the UK to do that, or France, because they have not paid Canadian taxes. In the same way, people on PragerU argue it should be illegal for anyone who's an illegal immigrant to get taxpayer-funded programs, and I agree with that for the record. But wait a minute. You're ignoring your own ideology here, sir. So our healthcare system has a lot of issues, like 45,000 people dying every year. And we should address them. But do we really want to upend all the advantages that we do have and start from scratch? Because that's what would happen if we completely turn healthcare over to the government. Yes, all the medical technology just disappears. So let's imagine we make the change. We hear a lot about how great free healthcare, no one says free healthcare, would be. But it's only fair we look at the downsides. Well, it's also fair we look at the upsides if you're going to play that card, and you haven't done that yet. The first is that government-run healthcare takes medical decisions away from patients, that means you, and puts them in the hands of bureaucrats. You know, I swear I heard this somewhere before. Let me think. Oh yeah, it was just before Medicare was passed. The American Doctors Association got Ronald Reagan to do a record about how that would lead to everyone being enslaved. That hasn't happened. Also, bureaucrats are more accountable than healthcare CEOs. At least bureaucrats can typically be fired by politicians who are elected. CEOs are accountable to literally no one but themselves. Yeah, I hate to break it to you, but that anti-bureaucracy argument never actually pans out with reality. They decide, for example, how many MRI machines are going to be available, or under what conditions you can get back surgery or a bypass, or even whether you qualify for cancer treatment. Yeah, that's what's known as, I forget the exact name. But more or less, would you prefer the US system where it's a wall biopsy, aka who pays the most gets the best health care? Oh wait, you probably could pay the most. That's how it works in the United Kingdom under its single-payer system, and especially after a series of budget cuts done by people like Margaret Thatcher and David Cameron, who Dennis has actively supported and who were friends with the Hoover Institute. Because it has finite resources, rumor has it, the National Health Service, or NHS, sharply restricts access to treatment like hip and knee replacement, cataract surgery, and even prescription drugs to deal with common conditions like arthritis and diabetes. Citation needed. If you suffer from any of these ailments and many others in the UK, you may just have to live with the pain. As opposed to now, where people ration insulin and then are found dead. That actually happened. I'm not making that one up either. And let's hope you don't have a medical emergency. In January 2018 article in the New York Times, patients in the emergency room around London are described as having, quote, to wait 12 hours before they are tended to. Corridors are jammed with beds carrying the frail and elderly, which we've never had in the U.S., you know. Look up the medical conditions of Ellis Island sometime. That's kind of interesting. Actually, that was a government-run healthcare system that I'd say was kind of cramped at points, but pretty successful overall. And can I just point out, by the way, those were immigrants who hadn't yet paid taxes and were in some cases deported. They got taxpayer-funded health care. Where do we in the U.S., who are already here, get? Nothing. To deal with the situation, hospitals were ordered to postpone non-urgent surgeries. Non-urgent, okay. What did they mean by non-urgent? Did they mean a colon replacement, or did they mean, I don't know, a boob job? Because I honestly do think people with boob jobs, who need boob jobs, should have to be on a waiting list, personally. Especially if the other person has cancer. This hardly seems like an improvement over what we have in the US. You haven't actually used any words. A second big problem with single-payer system is that they are expensive. Really expensive, as opposed to now, where healthcare is just given to us by the magic generosity of healthcare CEOs. How childish is this guy? A recent study by the Mercatus Center at George Mason University found that the Bernie Sanders-style Medicare for All healthcare system would cost a tidy $32.6 trillion over 10 years, and yet the American people already spend about $49 trillion on their private insurance. But I believe. That's on top of what the federal government spends on healthcare today. Okay, wait a minute. So, that's just a nonsense statistic right there. If we expand the VA and expand Medicare, that's just going to be part of the Medicare budget, dude. That money's just going to sort of get funneled in with all the rest. But I'm nitpicking, I know, but it's just everything about this guy annoys me. Other studies have found costs can be roughly the same range. So how would we pay for it? How are we paying for our current system? Kenneth Trope, a professor at Emory University and health policy officials in the Clinton administration, spells out, if you're going to go to this direction, Medicare for all, the tax increases are going to be enormous. Not just for the rich, Trope estimates, but for working Americans and the poor, too. Can I have an exact percentage, please? Like, give me the exact marginal tax rates that would need to be in for this plan to exist, or I'll just assume you're making it up. Charles Balahos, the author of the Mercatus study, puts it this way. Even a doubling of all projected individual and corporate taxes would be insufficient to finance these added federal costs. And he considers that a conservative estimate. Okay. Again, what would the projected tax brackets have to be? Canada knows all about exploding healthcare costs. In Ontario, the country's biggest province, those costs took up 46% of its entire budget by 2010. By 2013, that number is projected, some people say, to be 80%. In other words, in a few years, Ontario will have little money to pay for anything except healthcare. Oh no, there'll be too much healthcare. I don't even know what he's trying to say at this point. Finally, and perhaps most importantly, government-run systems distress the search for new cures. Okay, complete lie. Most of medical research is done at universities, which don't have private incentives. Biomedical research spending in the U.S. far outpaces that of any country with nationalized healthcare, even when you account for differences in population or size of economy. Citation needed. That's one reason medical breakthroughs rarely come from countries where government controls healthcare. They come from the United States, where the government doesn't. You know, funny story. The guy who made the polio vaccine didn't actually make any money off of it. He never patented it. He was a professor who spent his days blending monkey kidneys trying to find a cure for polio. And when he did, he gave it out for free. But people like him just don't exist. You know, and again, I didn't he do that because his family was struck with polio? There will always be incentives to get better medicine. That incentive is sometimes just as simple as, I don't want to die. The lion's share of biomedical research and development spending in the U.S., over $70 billion in 2012, comes from the private sector, discovering and there wouldn't be nonprofits, apparently. You know, looking for cures. Discovering new medical cures and technology is a profitable business, and thank goodness it is. Those profits drive innovation, take away the profit. Doctors still get paid under single-payer systems. I don't think these people realize that. And you will surely take away the innovation. You've heard this all before. I'm done with this guy. There's like 2 paragraphs left. So I'm just gonna... It's just him signing off. I'm Ephrom, and good night.